Hi everyone, I am Rachel. I am currently in a mental health clinic in New South Wales, Australia. Being treated primarily for depression, anxiety and OCD, although I have also battled with anorexia nervosa since I was 14. For those of you who are interested in what I have to say, I do have a YouTube, Running Saxophonist. Over there I'll be making videos tailored more specifically to different mental health disorders, and also some off-topic videos. So just before I get into it, I just want to point out that I am not a clinician. My training is in biomedical science and medical statistics. I am not a doctor. If you are in a crisis, please seek out medical professional help. I've just got a few numbers. So in Australia, Beyond Blue is 1300 224636, Kids Helpline 1800 55 1800, Lifeline 11114, and Suicide Callback Service 1300 659 467. So in these streams, I've been primarily talking about mental health and my conditions, my situation in hospital, my experiences, and answering your questions that come through on the stream. So please ask me your questions, then send through your comments, and I will be, and I'll try to answer them. Primarily in the future, I'll be communicating to you through my YouTube channel. As I said, if you are interested, go over there and check it out. Right now, it's just a bunch of these streams that I'm putting up, but in the future, it will be tailored videos. So yes, please send me through your questions so that we have something to talk about. Otherwise, I guess I'll just be talking about my experiences like I did in the previous streams, and they seem to go pretty well. You guys were really lovely, so thank you to anyone who did join me. Alright, so I do have a few questions that I got from the previous streams, so until we get anything through the chat, if anyone decides to join today, I just thought I'd answer those. So the first one was, what was your experience with electroconvulsive therapy? So yes, I have gone through electroconvulsive therapy. That was about 5 years ago. I was being treated for, everything: anxiety, OCD, depression. Those were the three major ones. Essentially, a lot of people have this false idea about it, which is that it's very barbaric, the sort of thing that you see in One Flew Over the Cuckoo's Nest. I was terrified of it. I didn't even know that they still practiced it. But yeah, by that point I'd tried pretty much all the medications that I could safely use. And my treating psychiatrist decided, let's just try electroconvulsive therapy. As I said, I didn't even know it was still being practiced around here. And it was only at that time that I learned that my great-grandmother actually went through it back in the 50s, and of course back then it really was quite barbaric. Different. I made the mistake of watching One Flew Over the Cuckoo's Nest the day before I came into hospital, and that was definitely a mistake, but it's nothing like that these days. So essentially what happens is you're put under general anesthetic. It's all done under general anesthetic. So you lie on the table, they put the drip in your arm, they put in the general anesthetic, and you're out. The whole idea is that they induce a seizure, and it's really carefully titrated. So your first few sessions are just figuring out what strength you need, because the idea is that they want to use the minimum strength required for you, and for everyone that's going to be different. So what I believe the idea is that it's meant to stimulate particular areas of the brain, which in people who have had long-term depression and anxiety and that sort of thing, those areas of the brain currently aren't working as well as they should be. And so the whole idea is that it's supposed to stimulate those areas of the brain. So, as I said, you're completely under anesthetic. Half hour later, woke up in recovery. That was pretty much it. To be honest, I quite enjoyed it because I did enjoy the feeling of the general anesthetic. Unfortunately, I didn't respond to it, but I have seen a lot of people who have had fantastic responses to it, and there actually is the opportunity to do maintenance ECT, which is essentially you come in on an outpatient basis and just have it usually once a week. One of the big concerns a lot of people have is memory issues, and I did meet one person who got severe memory impairment from it, but I've never met anyone else who has. I did have a few memory issues, but to be honest, I was so terribly depressed at the time that I don't mind it, and it was really only from that time. I certainly didn't lose any long-term memories or experience anything afterwards. And as I said, I've never met anyone who did experience that. The only side effects I got were some jaw pain afterwards, and that's because during the seizure you can bite down, and a little bit of a headache, but other than that, and the only real complications from it are due to the complications of general anesthetic. So I think it's like 1 in 50,000 people. And yeah, that's from the general, it's not from the ECT itself. Alright, so let's open this chat here. Mountains or beaches? Mountains, mountains, mountains all the way. Cake or pie? I'm gonna go with pie. I'm not a fan of cake. They let you have phones, not in America. Yeah, so this is actually a public health clinic. Sorry, not public, private. So you do have to have the top level private health insurance, which does cost quite a bit of money, but in here, if you don't have it, it's very, very costly. And yeah, in here, it's, minimum security. There are 3 categories of patients. So there's 3, you come in, you stay on that for a night, and that means no leaving the unit. 2, which I believe it's leaving the unit for a particular amount of time, and then 1, which is essentially you get free leave between the hours of, I think it's 8 a.m. and like 8 p.m. You have to be back here overnight. But people are mainly here for medication reviews, more intensive therapy, or if they're just going through a life crisis that they really need to be removed from. So you're not going to find people here who need higher levels of care. Yeah, you're allowed your phone, you're allowed your devices, all of that. It's very nice. It's very nice here. Obviously, I'm still quite uncomfortable being here, and I've been here. This is my 6th stay now over the past 5 years. But they do make it homey. I've also been I have been in a public mental hospital, and it's as you've said, no phones, no devices, essentially locked in a room. You're not allowed to wear your own clothing, that sort of thing. It was pretty horrendous. Luckily, I actually wasn't admitted. I was sent there by my GP, who essentially said either you go there now or I'm going to get you scheduled. I waited for 8 hours in the waiting room, and then a doctor saw me for the assessment, and he said, look, you're severely depressed, but you're completely lucid. I don't want to admit you here because the whole idea is you don't get better here, you just stay alive here. And for some people, particularly those who are psychotic, those who are a real danger to themselves or others, it is the right place, but it can be quite traumatizing. Certainly not to say that it's a terrible, certainly not to say that it's not required. You've had memory issues from multiple surgeries. Oh, I'm terribly sorry. Terribly sorry. As I said, some people do. Did you check yourself in? Yes, as I said, this is a private hospital. You can't be scheduled here. There are situations where someone may say, look, either you're going to go to this hospital or I am going to schedule you. So, it's kind of a choice. But no, for me it was a matter of I need to be out here. I like your hands. Thank you. I find them to be quite wrinkly and gross, but thank you. Have you ever thought about ketamine as a treatment? Definitely. I'm at a point where I will try anything. If there's something experimental, I want to try it, because I am just at such a place where I feel like I've been through everything and I'm just feeling very, very hopeless. Yes, I would definitely like to. I've looked into the ketamine. It's certainly not available where I am, and I know that's really quite expensive where it is. But yeah, if there were trials around here, I would put my hand up in an instant. Have you consulted about doing these live streams with your medical team? I have. I have with one of my medical team. They said that if you're comfortable doing it, then go ahead. Yeah. That's poignant, getting better versus staying alive. Yeah, exactly. I've worked on an inpatient psych unit, and that's exactly what it was, and I never thought of it that way. Yeah, I had a family member in one of those units, and they really did need it. They had a psychotic break, and they were very very unwell. Luckily it only lasted a day or so, but they were in a situation where they did need that high level of care, and they were a potential danger to themselves. It was awful to see them that way, and it was awful to see them in the hospital bed and see them like that, but they did become lucid because of it, and we're incredibly grateful that they were there. It is needed for some people. And the fact, and you working there, I just want to say that you must be so strong to do that. I just want to say that, and I just want to give my huge gratitude to anyone who does work in the psych units, whether it be private or public, because you guys are so strong, and you guys are what allow people like me to get better. Or at least give us the opportunity to get better. What is your diagnosis? Major depressive disorder, also termed unipolar depression, or treatment-resistant major depression. Obsessive compulsive disorder, anxiety, and anorexia. Cheers, be kind to yourself. Yeah, thank you, and everyone out there, be kind to yourself, because you're worth it. You are worth it. I promise you of that. Because of your bravery to show your situation, you have many on your side. I am one of them. Thank you. As I've said before, I am nothing special. I assure you of that. There are so many people out there in my situation, or in far worse situations. My whole reason for doing these streams is that I'm very, very tired of being silent, and I'm very, very tired of feeling like I need to be silent. And unfortunately, the vast majority of those with mental health issues, we don't speak out because there is this huge stigma surrounding it, and because out in the real world you can't talk about it because there's still such huge misunderstanding, whereas in reality, mental health is just as valid as physical health. This is an illness as real as any other. In the sense that they have done fMRI studies to look at the brain and to see that yes, there are differences in neurotransmitters of people who do have depression, who do have anxiety, who do have all of these different disorders. Yes, they can see that there are structural differences in the brain. So in that sense, it really is a physical disorder. All right, you are cool. Thank you very much, as are you. How does somebody accept they need help? If it is causing distress in your life, if you are feeling impaired, if you are not able to complete the task that you used to, if you're not finding joy in what you used to, then this is when you need to seek help. Even if you don't know, even if you're not diagnosed with a mental health condition, this is when you need to seek help, and you are worth help, and there is help out there. I promise you of that. something that I've said in previous streams is that first step is often the most difficult one. It certainly was for me. And what I suggest in those situations is, if you're not at the situation where you're ready to make the phone calls or seek out a doctor, which can be very, very difficult, then open up to those around you who you really trust and let them do the next step. Let them call the doctor, or let them call your GP. Let them find who needs to be spoken to, and then you go to the appointments, okay? Let someone else do those first steps, because they can be the hardest. Even if it's seeking an online therapist, which is certainly a very valid form of therapy, even if that's where you start, great, that's a great first step. I'm just going to read out some numbers again. I did at the beginning. So in Australia, I apologise, I don't have numbers for other countries. Beyond Blue, 1300 224636. Butterfly Foundation, 1800 334673. Kids Helpline, 1800 551800. Lifeline, 131114. Suicide Callback Service, 1300 659 467. So if you are in crisis, please, at the very least, seek out one of these helplines, okay? There are trained professionals at the end of those lines, and they will listen to you, and you do deserve to be listened to, and you do deserve to be helped. So yes, back to the initial question. If you feel impaired in your life, if you're not finding joy in the things that you used to, if you're unable to function in daily life, then these are all symptoms of mental health issues, such as depression. Please seek out help, because it's nothing to be ashamed of. And because, I mean, if you broke an arm, would you expect to get through that yourself? No, you go to the doctor, you get it reset. You go to the doctor and you do the therapy required for it. And it's the exact same with a mental health condition. Don't expect yourself to be able to pull yourself out of it, because they are real, and some require medication, some require very intensive therapy. Don't expect yourself to be strong enough to get through it, or strong enough to not suffer it, because it's got nothing to do with that. Quite frankly, anyone who survives mental health conditions, anyone who gets through mental health conditions, anyone who accepts help, just in doing that, you're proving that you have strength beyond what many, if not most, people do. Are you in a hospital? Yes, I'm in a mental health clinic in Australia. I have a crushing feeling of not wanting to exist or just disappear. Look, I've experienced that feeling a lot. I experienced that feeling all night. It's one of the reasons I'm making this stream. And that is a major symptom of depression, of a mood disorder. And please seek out help, because it is not true. It is not true, the thoughts that you are feeling. It's caused by depression. It's caused by your mental health condition. And right now, it sounds like your mental health condition is not good, and it sounds like you are not in a good place. You that, all right? I promise you that, and my heart goes out to you, okay? And so many other people in the comment section, please let this poor person know that you support them. As I've said, I have a YouTube channel, Running Saxophonist. Please go check it out, because that's how I'm going to start interacting with you guys. And hopefully we can start a community that can speak out and also really support each other. Overthinking is an issue. Definitely, you tend to overthink things, and then you can become paranoid, or you'll start thinking that you've done something wrong, or that everything is wrong, or that nothing can be fixed. Try to remain present. I know a lot of you are probably cringing at that, and so am I. It is one of the things, and it does take a lot of practice though. Is it normal to get random waves of sadness every day? There are different degrees of sadness. Random sadness, that I said, my training is in biomedical science and medical statistics. I'm not a clinician, so please, if it is impairing your life, please seek out professional help. Don't take what I'm saying as gospel, because I am just one person giving my experiences. If random waves of sadness, it sounds like you're struggling, please seek out help. Yes, it can be a sign of a mental disorder, and in some cases it can occur in a normal person, i.e. someone who's not experiencing mental health conditions, but it also could be experienced in people who do have mental health conditions. So please seek out mental health. Seek out mental help. Sorry. I'm all the day tired, doesn't matter how much I sleep. Some advice about it. That also can be a major symptom of depression. I'm certainly feeling that most days. But it can also be a symptom of other things. I actually have some experience in the field of sleep medicine, and it can also be a symptom of a sleep disorder. So please seek out the help of a GP. How much does junk food contribute to mental health? This is really going to depend on who you are and sort of your general health. So for someone who has a restrictive eating disorder, it can contribute to mental health in the sense that you feel guilty, but it can also really help your mental health in the sense that it can put on weight. For people who don't experience that, the occasional bit of junk food. I'm also not a nutritionist, so again, seek out, if you do feel it's a problem with you, please seek. Become a problem in that you're too depressed to it has been shown that nourishing your body and giving your body those vitamins and minerals that it needs is massively important in mental health. But having the occasional bit of junk food certainly isn't going to negate that. It's only really a problem when you do have it all the time, in which case you may be deficient of those vitamins and minerals, and you may suffer other metabolic conditions. But again, style by any means, it is a living hell. Anyway, sorry, very passionate about that. I've experienced a lot of stigma against that, but there are many similarities between anorexia nervosa and other eating disorders and addiction, and oftentimes an inpatient unit is required because it does require really intensive therapy and perhaps medication to treat. I have really bad anxiety, but I can't tell my parents if they believe I should just get over it. And if I am looking sad, they would am so, so, so sorry. My heart really does go out to you. Not having a supportive family, not having supportive people around you, that is really horrendous. Obviously it's different whether you're underage or not. I would really suggest calling one of the helplines. So again, I'm just going to read those out. So these are for Australia. I'm sorry. Do an internet search for your own country, because I know that there are help. And many studies that go on behind it, but for every individual person it's going to be different, and so you really do need to seek out help on an individual level, and your school counsellor can certainly be the first step. So please, 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 do you have people with schizophrenia in there? Yes, we do. I use sarcastic humour and cynicism as a front to hide the pain. I feel that too. I have a lot of cough and humour. I'm big into the cough and humour, and there's some great self-deprecating memes out there. But you know, ultimately you can't and you shouldn't hide it forever, because there is help out there for you. So please, please, please do seek out some help. Any recommendations for depersonalization? I've only experienced that very, very mildly myself, but there are many people in here who do experience that. Speak to a counsellor, speak to a psychologist, psychiatrist, even if it's just your GP to start with. There are medications to treat depersonalization, but there's also a number of grounding techniques. You can look some of those up online. There's one very simple one, 5 things you can see, 5 things you can touch, 5 things you can smell. And that's a great one, but there are certainly more techniques out there that you can learn. what do people with schizophrenia do? What are some things that are special about every group of six? You mean the different types of mental health conditions, I presume? Look, there's nothing special about a specific group because of their condition. Just as everyone with a broken arm isn't the same person. Everyone here is individual and everyone here is special in their own way. And I know that sounds really, really stupid, but I cannot say enough how amazing everyone in this hospital is, and it's so devastating to see them suffer, but everyone in here is so open. I've never had a negative experience. Who walks these halls is going through something horrendous in their own way, and we are as deserving as anyone else of a listening ear and a caring heart and a hug every now and then. It's funny because I find myself having really deep conversations with someone who I've just met. I've made some amazing friends in here. I don't know their favorite color, but I know how many times they've been in hospital. You look like skinny Emma Watson. Thanks. Yeah, thank you. Suffering from, look at your phone. I don't know what you mean by that. Someone else said it. I'm not quite sure what you mean by it, so let me know. What am I doing wrong? Do you spend most of your time alone or with a lot of people? Alone. Yeah, I'm just one of those people. For old hack, thank you. You just put some great helplines there. I'm stunned. I've never encountered someone with so many of the same issues as I have. Just today, another stigma with anorexia situation. I'm so sorry. Thank you for making me feel less alone. You're wonderful for doing this. Thank you. That means the world to me. I'm so sorry that you've suffered too. That it's horrendous. It really is horrendous. And it sounds like you're think that everyone has. My heart goes out to you. With that, I'm just going to. With that, I'm just gonna say that anyone out there suffering from a mental health condition, suffering from a mental illness, please seek out help. Seek out professional help, because there is help out there and you are deserving of it and you are worthy of it. I promise you of that. There are mental helplines if you just want to make a phone call, if that's the first step. There are online forums. There are resources out there for you, and you do deserve to have those resources. You do deserve all the help, okay? Never be ashamed of these illnesses, because they are just as valid as physical illnesses. And nowadays, 50 years ago, depression was seeing that it's a very valid, very common illness, and people aren't immediately seen as insane for experiencing it. My heart goes out to all of you who are struggling from mental illness, because the stigma and the misunderstandings are horrendous, and you do deserve better, and you do deserve to have a life. So please seek out help. You are worthy, you are deserving. I will just say again, I have a YouTube channel, Running Saxophonist. That's how I'm going to be communicating with you guys. At the moment, I'm just posting these streams, but I do plan on having videos on specific mental health topics such as depression, anxiety, OCD, anorexia, electroconvulsive therapy, transcranial magnetic stimulation, different medications, and maybe some off-topic videos. So head over there. Hopefully there'll be a community over there, just if you're interested in me. I'm not a very interesting person. So yeah, I'll call that it for today. I'm sorry I couldn't answer all your questions, but please send me some messages over on YouTube and I will try to get to them. Please stay safe, stay well, and know that you are worth it and you are special and you are deserving of help. Alright, thanks guys. I'll be back for another stream either tomorrow or the next day. Alright, thanks everyone. Bye.